married 2 years ago. He snores, but I'm very deaf. I take my hearing aids out and I don't hear a thing. But I make nasty noises, and it's very unfair.
Do you know, you must be an absolute first in this country, a woman who admits snoring.
Yeah. If you ask them to put their hands up, there'd be an awful lot of them.
Oh, I bet they won't. I bet they won't. So, snoring,
Yeah, I mean, it's a really common problem. Actually, we think about 40% of the population are snorers. We know that men are more likely to be snorers than women. Women often don't report it, though men are more likely to go to their doctor about it.
Women often deny it.
Snoring is caused by the soft tissue in your airways from vibrating when you breathe in and out when you're sleeping. It can come from your nose or from inside the mouth as well. So when we try and work out how to treat snoring, we try and work out whether you're a nose snorer or a mouth snorer. And one way of doing that is actually if you block one nostril and breathe out through it and then compare it to the other side. If it feels like the air isn't coming through your nose the same on both sides, it could be coming from the nose. So nasal polyps, inflammation, rhinitis of the nose, or if you've had a broken nose, that can affect the breathing.
Can I just ask, Francie, what you've tried so far?
Right. I've tried one of those gum shields to push the jaw forward. I've tried scaffolding in the nose.
Good Lord.
Plastic thing. Breathe Right strips. I've had a snoring ring. And I've tried spray, and absolutely nothing works.
Right, have you met the surgeon on the end?
Yeah. I'm sure he'd do a job on me, but it would cost.
Dirk, I mean, is that all that's left open to Francie?
Well,
She's tried all that?
I think she's now primed for ready to go under the knife, go through surgery. What Anita said, if the problem is an obstructed nasal airway, probably due to our deviated septum, we could do a septoplasty. We put it straight, and that could help her. But I think she already had some surgery in her nose, and it didn't help her. No. So it looks like she's a mouth breather, and the problem comes from the soft palate, the soft tissue around the uvula in her mouth. And when we inhale and exhale, sometimes the soft tissue is too loose, and the air makes it vibrate, and that's what we hear as snoring. So that would be now an ENT specialist surgery. They could excise the uvula, they could excise tissue, the soft tissue palate, and they could tighten it, and that would help.
I presume diet's not much use here, is it, or is it?
Well, obviously this isn't the case in Francie's situation, but obesity makes a big difference, and we know that snoring regularly happens in 35% of people that are obese rather than 11% of people that aren't. But even in people who are a healthy weight, snoring can be a real key indicator of underlying health. So people that regularly snore have double the risk of developing metabolic syndrome. That's high blood pressure, diabetes, high cardiovascular disease risk. So it's even more important to get yourself checked in terms of your blood pressure and cholesterol and take care of your health, because actually the risks are higher.
And don't drink red wine before bedtime, he said, speaking from personal experience. Thank you very much, Francie. Now, in the papers this week, some goggles have been launched to help you sleep. Anita, will these be any good for Francie's husband?
Alan, I'm going to get you to model these again, since you're doing such a good job today. Yeah, we don't know too much about these. Obviously, they're very fetching, so...
I feel like Hugh Grant.
This might be something useful for your husband. It's designed by scientists in Australia using a special green light. It's thought to stimulate your sleep-wake cycle and give you a better quality of sleep. We haven't got clear evidence whether it works well yet, but the studies so far look encouraging.
But you don't wear them to sleep in?
No, you wear them in the morning for 30 to 50 minutes every day, just to stimulate your own melatonin.
Fine, I'd send my wife to sleep if I wore them. Our next patient is Jane Redmond. Come and join us, Jane. Thank you, Francie. Quick on this one, chaps, please. Jane, your problem?
I've noticed as I've got older, my eyelids have started to drop, and I tend to get mascara stuck on the eyelid, and it's gone puffy.
Well, that's a typical aging process. Our eyes age the first, and what we see in her case, she gets more and more skin that droops, and also it gets more and more puffy. That's a puffy look, and that's due to orbital fat, which usually surrounds the eye and the skull to protect it, but with aging, it kind of bulges outwards under the eyelid skin. Now, probably no cream's going to happen anymore. She needs surgery.
What would it cost? I'll have to be brief on this.
I'm telling you, I'm not going to tell you now yet, because maybe it doesn't cost anything. The thing is, it's not just for cosmetic reasons. The thing is that if she doesn't do anything, it will droop and droop more and more. And a lot of patients I see in my office, they complain about impaired peripheral vision.
Yeah.
So they're not doing it because it doesn't look good.
It's not
they
just cosmetic.
They can't see so much from the side anymore. So we're going to resect the skin, and with my TBT-Eyelift, I'm going to push back the orbital fat, and she's going to have a very natural result. She's going to have eyelids like that.
Fine.
And the NHS, in this case, would pay for that.
Don't forget, if you're considering plastic surgery, always do your research and seek advice from your GP first. Plus, if you have a medical question, email us, alan@itv.com, and our doctors will be back next Wednesday to help answer them. My thanks to Dr. Anita, Lucy, and to Dr. Dirk Kremer. Thank you.